I'll proceed to introduce our second speaker. So our second speaker is Gerald SER. He is from the University of Malaya, a student who has a medical student who has recently graduated. So congratulations to you. And today he will be sharing with us a student-led study. So the study is titled, "What is our future workforce telling us? Insights from Malaysian medical students, career intentions." So Gerald, over to you.
Hi, thank you, Dr. Jaden. I will share my screen. So, just want to confirm if my screen is visible.
Yes, we can see it. Thank you.
Yeah. Okay. Good afternoon, everyone. Thank you. First of all, thank you for having me here. My name is Gerald, and as mentioned, I'm a recent medical graduate, and currently I'm attached to the Department of Pediatrics for my master's in research with the same university as well. So today, I'll be sharing about this project that we have been doing for the past few years. Uh, it's called the Malaysian Medical Students Career Intentions, and as the title suggests, we look into the career intentions of our medical students in Malaysia post-graduation. And this study was a student-led initiative. So today's sharing is going to be a mix of medical education and perhaps a bit of healthcare system planning as well. So I'll first give an overview and the problem that we have here in Malaysia and how we do our study and what we found from this research and finally what it all means. So first, to give everyone a better context of how a doctor is being produced in Malaysia, I'm going to use the growth of a child to describe the medical education and training system here. So from infancy to toddler, this is where you lay down your foundation for life. And these are the formal schooling years in Malaysia, which takes between 12 to 13 years. Then you go into early childhood, where you're curious and you start exploring around. And this is the 5 years in medical school. Subsequently, being an adolescent, you start to learn to take care of yourself and figure out what you want and what you like. And these are the housemanship years, which are also called the internship years, foundation training in different countries. And this takes 2 years in Malaysia. And when you go into young adulthood, you build your career, relationships with people, and you're still continuing to learn. And this is when they go into residency training or what we call specialization in Malaysia. And this typically takes 4 years. And finally, when you're an adult, you're out there independently. And this is when you become a specialist. In order to obtain the Malaysian Medical Council license, one must complete housemanship training in a government hospital. And this is an ideal situation for a doctor's growth. However, oftentimes the reality is far from being ideal. There is a bottleneck that exists between the stage of housemanship and entry into specialization and subsequently becoming a specialist. Medical education in Malaysia is largely divided into institutions that are publicly funded and those that are set up by private institutions. And the tuition fees can range widely between the type of institutions. Meanwhile, healthcare system in Malaysia is also divided into publicly funded hospitals by the government and hospitals that are private and patients who have to bear the full cost when visiting these hospitals. Now, the challenges in healthcare in Malaysia ranges from human resource to financial issues to infrastructural problems. There is simply not enough training spots for specialization, and that leaves a large number of doctors stuck at a stage with no career progression, and together coupled with low pay, poor working environment, the situation is just not optimal. There are issues of doctors quitting after finishing compulsory service, leaving the country, brain drain, and simply just not enough doctors everywhere. And this has been frequently highlighted in the media by politicians, by the public, by academicians, by doctors, and even most recently by CNA. Basically, this has been gaining a lot of attention locally as well as regionally. Now, let's take a step back and perhaps find a comparison to figure out where do we stand in terms of doctors intending to leave the country. What do we know about the intention to migrate among medical students globally? We have several studies coming from South Asia, from Pakistan, India, and Sri Lanka, where the range is between a quarter to half of their medical student population intending to migrate after they complete their medical education. Over in Russia, we have very low percentage, 4.7%. Going over to the Middle East, it's very high at 89%. And similarly in Africa, in Nigeria at 85%. Meanwhile, over the Europe, in the UK, it is about a third, while Ireland has something contrastingly different at 88%. And you will notice that after describing all these countries, there is no mention of North America, South America, East Asia, Australia, New Zealand, as well as Southeast Asia. So there have been a lot of issues that have been brought up so far, but let's come back to the questions that we perhaps have from the point of view of medical students, medical educators, or even from the medical school. Because essentially the primary purpose of a medical school is to produce doctors that can contribute to the healthcare system in the country. And this could also mean to produce doctors who are competent to do the everyday task expected of a junior doctor. So we would really want to know where are our graduates going and what do they feel about the medical education that they have been receiving. So what we basically did was a national and multi-center cross-sectional study. We tried to involve as many medical schools in Malaysia as possible, and we have obtained 859 responses, ranging across all the different years of study. And we did this via an online questionnaire, and subsequently, we analyzed the data. So for our respondents, we have a fairly good distribution between the types of medical school as well as the stages of training. In terms of the gender, the respondents was primarily female dominated, and this is because the fields in science in Malaysia are generally dominated by females. And what we found in our study is that 9 out of 10 are planning to complete their housemanship in Malaysia. And this is a good sign for the Malaysian healthcare system because junior doctors essentially form the foundation of inpatient clinical services in the public hospitals. However, it is also important to note that there is already a small portion who intend to migrate immediately after medical school. And when we asked them what they thought about their medical education, 7 out of 10 think that they will be prepared for housemanship, which is quite a good number because it means the majority of medical students feel confident about the medical education that they have been receiving. But what about the remaining 3? What are the factors that we can look into to make sure that this remaining 3 will also feel confident and well prepared for housemanship by the time they graduate from medical school? And how do we improve the delivery of our medical education? Our sub-analysis found that those of male gender, preclinical years, as well as coming from public institutions, were more likely to perceive that their medical school has prepared them adequately for housemanship. And it is interesting to note that preclinical years thinks that they are better prepared compared to their clinical counterparts, which brings down to the question of whose response is more reliable. Taking into account that preclinical students have limited exposure to clinical activity in the hospital, meanwhile, clinical years primarily span their learning hours in the hospital. Although this is a cross-sectional study, so we can't talk about longitudinal changes, but could this potentially suggest that the confidence in being adequately prepared for housemanship decreases as they progress from preclinical to clinical years? Or could the preclinical group be answering this based on the preclinical lectures that they have received and the perceive that the knowledge they gain from those lectures are adequate for housemanship? In terms of the types of institution, Most public universities are well equipped with their own university hospitals, which provides unlimited and seamless access for their own medical students, while the private medical schools relies on the public Ministry of Health hospitals. So could this be the factor that is affecting the difference in preparedness? Looking into the aspects where medical students perceive should be improved in medical school, the skills needed for daily tasks came up at the top. And this isn't confined to just clinical skills, but it also includes skills working in a multidisciplinary team, working with other healthcare workers, referring patients, managing multiple tasks at the same time. Basically, the responsibilities of a junior doctor. And in our sub-analysis, private universities cited clinical exposure requiring improvement. And this can potentially explain the reason why they feel less prepared for housemanship compared to their counterparts in public universities. And moving on to the next phase in their career, we were wondering how many of our medical students see themselves serving in the Ministry of Health for long term. And the positive note is that majority wants to stay on. But then again, out of the 10, we have 4 who are planning to leave. So that is still a figure. And we need to know that up to more than 3/4 of Malaysians rely on the public healthcare system. And Malaysia is an aging nation. Thus, the demand for healthcare will undeniably increase. And this will further strain the current healthcare system, which is already under immense pressure. As a whole, slightly more than a quarter of our medical students intend to migrate. And of those planning to migrate, a quarter plan to do it immediately after medical school, while the remaining after completion of housemanship training. And upon sub-analysis, we found that it was statistically significant that private university students were more likely to migrate compared to their counterparts in public universities. And in terms of the top destination countries, our findings reflect the global trend, where the top destination included Australia, where more than a quarter, United Kingdom, as well as Singapore. We provided them a list of options to select which were the factors that were important in deciding to move abroad. And the top 3 reasons included working environment and conditions, working culture, and job security. While the least important reasons were duration of specialization and training, ability to choose a work location, and finally, personal reasons. In our study, we also looked into the intention to specialize, and it is indeed a very positive sign to note that a very large majority of our medical students want to pursue further specialty training. And the popular specialties we found in our study reflect the global trend, including general surgery, pediatrics, and obstetrics and gynecology. Meanwhile, the least popular specialties were pathology-related specialties. And in our sub-analysis, we found that medical students from private universities intend to specialize compared to those in public universities. And in terms of gender, male students were more likely to go for a surgical career, while female students were more likely to go for a medical career. So to sort of sum everything up, what do all these numbers mean? 7 out of 10 think that their medical education prepares them well for housemanship, which is good because the majority perceive themselves as being prepared for the workforce. But more needs to be done to ensure that the remaining 3 out of 10 will be confident for housemanship too by the time they graduate from medical school. And medical schools should place more emphasis on ensuring that students get adequate training and exposures in skills that they will need to perform as junior doctors. The majority of medical students in Malaysia wants to join the housemanship training, and this is important because, as mentioned, junior doctors form the foundation for clinical services in public hospitals. A sizable portion of Malaysian medical students intend to practice overseas. And this could mean several things. Number one, these students perceive that working overseas may potentially offer more benefit than staying locally. Number two, medical students in Malaysia feel they are ready to practice in a different setting. And could this perhaps indicate their perceived adaptability to foreign countries? And finally, a large number of medical students do intend to specialize, which is a good thing because even as early as this morning, there was a media report in Malaysia which mentioned that for our public healthcare system, a total number of 17,000 specialists are needed. However, currently we have only 7,000 specialists serving in the public system, which is only about 44% of what we require, which means there is a deficit of over 10,000 specialists. And it is very important because that we need to ensure that the healthcare system can provide enough training opportunities for these future doctors, ensuring that we have a steady growth of specialists in different fields in the country to fulfill our needs. And I'm going to pull back out a map again and finally put in our own data over there. So when we look at the global scale, our migration intention rate among medical students after medical school is perhaps moderate or comparatively low to other Asian countries. But then again, different regions have different contexts, and it is not good enough to just compare the numbers blindly. And this again marks the gap in the literature in our region. And prior to this, the response to doctors in the country leaving the service or migrating has been rather reactionary. However, with this data now, we can know their career intention very early on in medical school, and thus we can potentially anticipate the direction of growth of the healthcare workforce in the next 5 years. And this provides data for policymakers to plan the healthcare human resource in the country. And with medical students intending to complete housemanship in Malaysia and then migrate overseas to practice, it again highlights the bottleneck that is making it difficult for our junior doctors to progress in their career into specialization and serving as a consultant. Just a bit about this whole project is titled the Malaysian Medical Students Career Intentions, or we call it MMSCI. This was an entirely student-led research initiative with the support of the academics from our faculty. And so far, we have published one article in BMC Human Resources for Health, and we are in the process of submitting several other papers as well, analyzing the data that we have from this study. And from our part, we have presented our findings to the relevant stakeholders, which includes the Ministry of Health Malaysia, the Ministry of Higher Education, as well as the Medical Deans Council of Malaysian Public Universities. So moving forward, our strategy from the point of view of medical students, which was the basis of how this project started off. The MMSCI Research Initiative will be continued as a long-term effort to act as the platform for medical students to learn and conduct research, focusing on topics which are deemed to be important from the perspective of students pertaining to their future medical career in Malaysia, and to act as the voice of the medical students in Malaysia. From the point of view of medical educators, we now know the perceived preparedness of our medical students and the changes that they wish to see in our medical education system, and aspects that can be worked on to ensure that every medical graduate will be ready to perform as a junior doctor when they join the healthcare workforce in the future. From the point of view of policymakers, this is a reminder of the challenges that remain in the healthcare system. And with all this data that is finally available, data-driven and evidence-based policies should be implemented to reform and improve the healthcare system to provide better training and retain healthcare talents. And finally, for researchers in the field, there is room for potential regional collaboration to look at the mobility of medical graduates in the region, thus to further improve medical education and healthcare delivery as a whole, and retain healthcare talents within the region. And with that, I conclude my presentation. Thank you very much.
Thank you. Thanks, Gerald. for sharing. And it's always great to have the opportunity to listen to the students' voices. And thank you once again for sharing this during prime session where a lot of faculty are here to listen to what you have to share. So there's an influx of questions. So some of them I believe you address in the last slides that you have, but I'll just repeat those that I think I would like you to answer. So from Dr. Dujiba, thanks again for a very important study providing insights on Malaysian medical training. So I understand that you have shared this with the ministry. So his follow-up question would be, may I ask what are the implications of these findings for Malaysian healthcare policy makers and educators?
Yeah. So in terms of this, so what we have done from our part is we tried to reach out as many stakeholders as possible, which includes from the medical education side, meaning the higher education ministry, and then with the Ministry of Health, which is the clinical side. And we have reached out to this group of executives working in the Ministry of Health, which is under the Health Transformation Office, to actually sort of provide them with this data. And very, very recently, last week, there is a report that was released by the Ministry of Health, which actually looked into the planning of human resources for health in Malaysia, encompassing not just the medical doctor's point of view, but also including nurses, pharmacists. So it's a very a wide approach into how do we plan our human resource for healthcare in Malaysia in the future. And I think with our study, we have managed to spark the sort of the interest and attention into this issue, because oftentimes we are only looking into planning the human resource for healthcare uh, when uh, when they are in training as doctors, but we don't really look into the very, very early on stage where they are still in medical training. And oftentimes this might be when we identify an issue, the response might be 5 years late. Because, for example, if you're only producing 5,000 medical students a year and you realize that you need 7,000 medical graduates, and it would take 5 years down the road for that number to actually reflect later on. So we believe that with our study, we've managed to sort of spark the interest and actually to notify to the relevant stakeholders that you need to look into the medical students as well, not just at the medical doctors.
Right, thank you. So bringing to attention to the policymakers that there should be some focus with the students and keeping them in the country that they were trained at. All right. Okay, so I believe the next question you have covered. How are you going to inform the policymakers? You have shared it with the ministry. And then, yes, are there any plans to publish? And a call from Dr. Dujiba that we have our journal, the Asia Pacific Scholar. And if you have anything you wish to publish, we would recommend or we will encourage you to publish here as well. Okay. The second question is from Dr. Sushing. Sushing, I understand you have on your camera. Would you like to ask your question or I'll just read it off?
Um, I'll just elaborate a little bit.
Okay.
Because this topic is very clear, it is very close to my heart. And it has been there even when I were in UM in University Malaya. So we know that a lot of your seniors or currently who are doing their medicine degree in UM or other medical schools, they are very willing to stay in Malaysia. But then there is a bottleneck issue, as you have raised, when they go into residency or specialty training. So how can this data actually helps to resolve the bottleneck issues
So
that
for
you
this,
have?
it is, yeah. So thank you for the question. So basically, this bottleneck issue is sort of something that we have already known, even from the media, from the news. But what we know is oftentimes when doctors have reached the point of completing housemanship. So it is very late in the career of like, you know, the the whole doctor's growth. It's at the very late stage only we realize that, oh, we have so many doctors who wants to specialize, but we don't have enough training opportunities. So then it's very reactionary. Then they'll start to, okay, we need to open up more spaces. But with our study, we actually have the finding where 85% of our medical students wants to specialize. So then down the pipeline, you will need to know that, okay, you need to ensure that you need to provide training opportunities for 85% of your medical student population to actually go into specialization training. So this is the number that we have provided with our study. And prior to this, it is oftentimes, oh, you need more positions. Okay, we try to open up more positions, but it is not very data driven, which I would say.
So can I say that you have submitted this data to Ministry of Health so that they can create some policies or take some action
Yeah.
to retain some possible graduates from Malaysia?
Yeah, so under the current health minister, Dr. Zulkifli, he's embarking on a reform for the healthcare, and he has actually established a health transformation office with a specialized task force directly under him. And we have got in touch with this health transformation office with the people working in there, and we've directly presented our findings to them, identifying key issues that they should focus on, as well as basically acting as the voice coming from the medical students in Malaysia.
All right. Thank you so much for working on this, because I know this issue has been there for a long, long time. And of course, Singapore benefited from it. Can I also, sorry, Gillian,
No,
because
please
I
go
have
ahead.
another questions. I know that you have collected like 800 over responses. May I know roughly the number for students coming from the private and government medical schools answering these questions? What would be the number like?
So, in terms of our demographic profile, we have out of the 859, we have 467 coming from public universities and 392 from private. So it's about half, 54% and 45%.
Great. Okay. All right. Thank you.
Thank you.
Thank you, Sushing, for your questions. And just before I wrap up, I also thought I had a comment to make based on what I've observed or what you have presented. And yeah, you were talking about specialties, and something I noted was that the popular specialties tend to be ONG, pediatrics among our undergraduate. And it just made me wonder if because looking at the aging population, perhaps it would be useful to also spark some interest in like geriatrics, you know, things that are more commonly seen in the older generation. So that's perhaps something that as policymakers or as a school, they can try to show the importance of focusing on these specialties, and maybe hopefully we'll see a shift in the interest to these specialties that actually we will need more doctors to be specializing in as opposed to pediatrics and ONG. Yeah.
Definitely.
All right. So we have come to time, and thank you, Gerald, once again for your really insightful presentation. I enjoyed this a lot, and I'll hand this over to Sushing to wrap up the session.
Mhm.